Welcome to part 2 of Chart Reviewer training. In this section, we will show you in detail what is required of a chart. Here's our patient again. Remember him? This patient is really in need of a plan. Meet Sonia, our chart reviewer. As chart reviewer, Sonia knows that she needs to find all of the records that pertain to developing a plan for this patient. Some patients have many records. It can be daunting to know where to begin. Whoa, Sonia, one thing at a time. The first thing a chart reviewer needs is access to the records. So the first thing is that each chart reviewer, like Sonia here, is matched with a specific hospital. Along with this matching comes a list of designated patients from the hospital. Of course, we are talking about electronic records here. Now, every hospital uses a different electronic medical record system. For every electronic medical record system that a chart reviewer needs access to, a step-by-step guide will be sent to the chart reviewer. Okay, we're back to Sonia, our chart reviewer. Once she has the list of patients and access to the system and a step-by-step guide to that electronic medical system, then she's ready to get going. Now Sonia is ready to start collecting information that's relevant to pain management for each patient. This is very detail-oriented work. Sonia wants to create a comprehensive picture about the patient's history. Once our chart reviewer has compiled this information, then the draft is started. The draft, once it's completed, is downloaded to a designated server. We are using Dropbox. And at the same time, 2 letters are created from templates. The first letter is going to the primary medical doctor. And the second one is an informational letter for the patient, so the patient knows what is going on. Here, Sonia, our chart reviewer, is sending an email notification to the program coordinator, letting the program coordinator know that the drafts are ready for examination. The draft of the plan and of the 2 letters are now reviewable by the program coordinator and the primary medical doctor. Now, both of these doctors are given 7 days to review the drafts and give their input. If our chart reviewer, Sonia, gets any feedback, she makes those revisions to the drafts. This is the server to which Sonia, our chart reviewer, is going to submit the final PDF of the plan and of the letters. If 7 days have passed and Sonia hasn't heard anything, she's going to proceed. And now the program coordinator is going to retrieve the final plan, print it, and place it in the binder in ER. And now the staff have the plan. Our process is almost complete. Are things beginning to make sense? Here's a little quiz for you to check in with. Continue to the next slide to take the quiz. If you are satisfied with your score and feel you understand everything up to this point, continue on to the next slide. Otherwise, you may review the quiz. Now let's go back and dig a little deeper into exactly how plans are created. We're going to show you what a sample medical record will look like. Here's the top part of a report. Here's the continuation. We're going to show you this in detail later on. Here we start by putting in the basic information. And you can see here where Sonia is going to continue to fill in the information into the fillable PDF. And again, this is a reminder of how broad the information is that needs to be collected. So the question that you want to keep asking yourself as you view all of the information is, does this information relate to pain management? You're going to have a chance to practice with an actual chart. Notice the headings of each field. This is the kind of information you're going to be looking for. Next, Sonia is going to create a letter for the primary medical doctor. There's a template for this. Here's a sample of the letter to the primary medical doctor. Once Sonia has created this draft letter, she's going to put it into the designated server. Again, this is Dropbox. And remember that the other letter is to the patient. And this is what the template for the letter to the patient looks like. Once again, this goes into the same Dropbox server. Here's an overview of the steps so far. Please review them carefully. We have guidelines for the revision process. The doctors will get back to you within 7 days, and if they don't, you will continue to the next step. So the next step will be either revision, or if there's no response, continuing on to place the final documents into the server. Our chart reviewer is looking happy. She's almost done. And after the final documents have been submitted to the server, Sonia will now update the tracking spreadsheet. Very important step. Each cell, of course, must be completed, and as you begin filling these out, you'll see which ones are auto-filled. This spreadsheet is put on the server as well, so that everyone involved with any patient can see the status. And of course, a good chart reviewer knows the importance of keeping these records accurate and up to date. Yes, and now we have covered all the steps. Keep going. Now you have a chance to practice. So please go to this server and you'll find the chart and also an actual PDF of the plan. Complete the plan and then submit it to the server. This completes your training. Please send an email to Dr. Johnson. Let her know that you have completed your training, but if you have any questions, don't hesitate to ask.